If your headache feels like a tight band around your head, it could be your body's way of screaming for help. But if it's throbbing on one side with nausea, you might be dealing with something completely different. Most people think all headaches are the same. They pop a pill and hope it goes away. But your headache is actually sending you a specific message about what's wrong inside your body. There are over 150 different types of headaches, and each one has a unique cause. Knowing which type you have could literally save your life. In the next 30 minutes, we're breaking down the most common and dangerous headache types you need to know about. Pay close attention, because ignoring the wrong signs could lead to permanent damage. Let's start with the most common headache that almost everyone experiences. It's called a tension headache, and it affects nearly 80% of adults at some point in their lives. Tension headaches feel like someone is squeezing your head with a tight band. The pressure is usually on both sides and can last anywhere from 30 minutes to several days. What causes this type of headache? Stress is the #1 trigger. When you're anxious or overwhelmed, your neck and scalp muscles tighten up, creating that squeezing sensation. Poor posture is another major cause. If you're hunching over a computer or phone for hours, those neck muscles stay contracted, leading to tension headaches almost daily. Lack of sleep also triggers these headaches. When you don't get enough rest, your body releases stress hormones that cause muscle tension throughout your head and neck. Dehydration makes tension headaches worse. Even mild dehydration can cause your brain tissue to temporarily shrink, pulling away from the skull and triggering pain receptors. The good news: tension headaches are rarely dangerous, but if you're getting them multiple times per week, your body is telling you something needs to change in your lifestyle. Now let's talk about migraine headaches. These are completely different from tension headaches and affect about 12% of the population, with women being 3 times more likely to get them. Migraines aren't just bad headaches. They're a neurological condition that involves your brain's blood vessels and nerves. The pain is usually throbbing and intense, often on just one side of your head. Before a migraine hits, many people experience something called an aura. This can include seeing flashing lights, zigzag lines, or temporary blind spots in your vision. Some people get sensory auras instead. They might smell things that aren't there, hear ringing sounds, or feel tingling sensations in their hands and face before the headache starts. Once the migraine pain begins, it's often accompanied by extreme sensitivity to light and sound. Even normal lighting can feel like stabbing knives in your eyes. Nausea and vomiting are common with migraines. Some people can't keep any food or water down during an attack, which makes the headache even worse from dehydration. Migraines can last anywhere from 4 hours to 3 full days. During this time, many people can't function at all and need to lie down in a dark, quiet room. What triggers migraines? Hormonal changes are a huge factor, especially in women. Many experience migraines right before their period due to dropping estrogen levels. Certain foods trigger migraines in susceptible people. The most common culprits are aged cheese, processed meats, chocolate, alcohol, and anything with MSG or artificial sweeteners. Weather changes can trigger migraines too. Sudden drops in barometric pressure, high humidity, or extreme temperature changes affect the pressure in your sinuses and blood vessels. Stress is a massive migraine trigger. But interestingly, migraines often hit during the relaxation period after stress ends, which is why many people get weekend migraines. Bright lights and strong smells can trigger migraines in sensitive individuals. Perfume, cigarette smoke, paint fumes, and even certain flowers can set off an attack within minutes. If you're getting migraines more than twice a month, you need to see a doctor. There are preventive medications that can reduce the frequency and intensity significantly. Now let's discuss cluster headaches, which are considered the most painful type of headache humans can experience. They're sometimes called suicide headaches because of their intensity. Cluster headaches cause excruciating pain around or behind one eye. The pain is so severe that people often describe it as feeling like a hot poker is being shoved through their eye socket. These headaches come in clusters, meaning you'll get multiple attacks over weeks or months. Then they disappear completely for months or years before returning. Each attack lasts between 15 minutes to 3 hours, and they often occur at the same time every day, frequently waking people up at night. During a cluster headache attack, the affected eye becomes red and watery. Your eyelid may droop, and your nose on that side often gets stuffy or runny. Unlike migraine sufferers who want to lie still, people with cluster headaches often pace around or rock back and forth because staying still makes the pain feel worse. Cluster headaches are more common in men and usually start between ages 20 and 40. Smokers are at higher risk, and alcohol can trigger attacks during cluster periods. The exact cause is still unclear, but it involves the hypothalamus, the part of your brain that controls your body clock. This explains why attacks happen at the same time daily. If you think you have cluster headaches, you need immediate medical attention. There are specific treatments like oxygen therapy and triptans that can abort attacks quickly. Sinus headaches are often confused with migraines, but they're caused by inflammation and infection in your sinus cavities. The pain is usually in your forehead, cheeks, and around your nose. True sinus headaches come with other symptoms like thick nasal discharge, that's yellow or green, fever and facial swelling, or tenderness when you press on your sinuses. The pain gets worse when you bend forward or lie down, because these positions increase pressure in your inflamed sinuses. You might also notice a decreased sense of smell. Sinus headaches are caused by infections, allergies, or anything that blocks your sinus drainage. When mucus can't drain properly, pressure builds up and causes pain. Many people who think they have sinus headaches actually have migraines. Studies show that about 90% of self-diagnosed sinus headaches are actually migraines with nasal symptoms. If you have a true sinus infection causing your headache, antibiotics or decongestants will help. But if symptoms last longer than 10 days without improvement, see a doctor. Hormonal headaches affect millions of women and are directly linked to fluctuations in estrogen levels. They typically occur right before, during, or after your menstrual period. These headaches can feel like migraines or tension headaches, but the timing is the key clue. If your headaches consistently show up around your cycle, hormones are likely the cause. Pregnancy can either trigger more headaches in the first trimester or completely eliminate them in some women due to stable, elevated estrogen levels. Menopause often brings on more frequent headaches because of the dramatic hormone fluctuations. Some women who never had headaches before suddenly start getting them regularly. Birth control pills can either help or worsen hormonal headaches depending on the person. The week of placebo pills when estrogen drops is when many women experience breakthrough headaches. Tracking your headaches with your menstrual cycle can help you predict and prevent them. Some women take preventive medication a few days before their expected headache time. Caffeine headaches are incredibly common but often go unrecognized. If you drink coffee or energy drinks daily, then suddenly skip a day, you'll likely get a pounding headache. Caffeine withdrawal headaches usually start 12 to 24 hours after your last dose. The pain is throbbing, can be on both sides of your head, and gets worse with activity. Why does this happen? Caffeine causes blood vessels in your brain to constrict. When you stop consuming it, those vessels rapidly dilate, causing pain and triggering headache signals. The ironic thing, caffeine can also treat headaches, which is why it's in many pain relievers. But regular use leads to dependency, creating a vicious cycle. If you want to quit caffeine, taper down slowly over 2 weeks instead of going cold turkey. This prevents the withdrawal headaches that make most people go right back to their coffee. Rebound headaches are caused by overusing pain medication. If you're taking headache pills more than 2 or 3 times per week, you might actually be causing more headaches. Your body adapts to the medication, and when it wears off, you get a rebound headache that's often worse than the original. So you take more medication, creating a cycle. This happens with both over-the-counter medications like ibuprofen and prescription medications. Even natural remedies can cause rebound headaches if overused. The only way to break the cycle is to stop taking the medication completely for several weeks. The headaches will get worse before they get better, but they will improve. Working with a doctor during this process is important because they can prescribe transitional medications to help you through the worst withdrawal period. Exertion headaches occur during or after intense physical activity. They're caused by the increased blood flow and pressure in your head during strenuous exercise. These headaches feel throbbing and pulsating on both sides of your head. They typically start during the activity and can last from 5 minutes to 48 hours afterward. Activities that commonly trigger them include running, weightlifting, sexual activity, coughing, or straining during bowel movements. Anything that increases pressure in your head can cause them. Most exertion headaches are harmless, but in rare cases they can signal something serious like a brain aneurysm or tumor. If they're new or sudden, get checked out immediately. Warming up properly before exercise, staying hydrated, and avoiding exercise in extreme heat can help prevent these headaches. Some people also benefit from taking medication before workouts. Ice pick headaches are exactly what they sound like. They cause sudden, sharp, stabbing pains that feel like an ice pick is jabbing into your skull. They last only a few seconds. These headaches can occur anywhere on your head, but most commonly hit around the temples or behind the eyes. They can happen once or multiple times in a row. The pain is so brief that by the time you register what happened, it's already gone. But the intensity is startling, often making people gasp or stop what they're doing. Ice pick headaches are considered a primary stabbing headache disorder. They're harmless but can be alarming if you don't know what they are. If you're getting them frequently, indomethacin medication can prevent them. Otherwise, they're usually just a weird quirk your brain does occasionally. Thunderclap headaches are a medical emergency. They reach maximum intensity within 60 seconds and feel like the worst headache of your life, coming out of nowhere. This type of headache can signal a brain hemorrhage, ruptured aneurysm, or bleeding in the brain. If you experience this, call emergency services immediately. The pain is sudden, severe, and unlike any headache you've had before. It's often described as being struck by lightning or hit in the head with a baseball bat. Other warning signs include neck stiffness, confusion, vision changes, difficulty speaking, seizures, or loss of consciousness. These indicate serious brain problems. Even if the pain goes away, you still need emergency evaluation. Brain bleeds can be fatal if not treated quickly, and every minute matters. Hypnic headaches are rare and almost exclusively affect people over 50. They're called alarm clock headaches because they wake you up at the same time every night. The pain is usually dull and throbbing on both sides of your head, though it can be one-sided. Each episode lasts from 15 minutes to 4 hours. These headaches only occur during sleep, often during REM sleep. Some people get them multiple times per night, while others experience them a few times per week. The cause is unclear but might be related to the brain's sleep-wake cycle mechanisms. Unlike cluster headaches, there's no tearing, redness, or nasal symptoms. Caffeine before bed can actually prevent hypnic headaches, which is unusual since caffeine usually worsens other headache types. Some people benefit from preventive medication. Spinal headaches occur after procedures involving the spine, like epidurals, spinal taps, or spinal anesthesia. They happen when spinal fluid leaks from the puncture site. The hallmark symptom is that the headache gets dramatically worse when you sit up or stand, and significantly improves when you lie flat on your back. This happens because the spinal fluid leak reduces the cushioning around your brain. When you stand up, gravity pulls the brain downward, causing pain. Most spinal headaches resolve on their own within a week with rest, hydration, and caffeine, but severe cases may need a blood patch procedure to seal the leak. If you have a spinal headache that isn't improving, contact your doctor. Untreated spinal fluid leaks can lead to serious complications. Post-traumatic headaches develop after a head injury or concussion. They can start immediately after the injury or develop days later and persist for months. These headaches can feel like tension headaches, migraines, or a combination. They're often accompanied by dizziness, memory problems, concentration difficulties, and mood changes. Even mild concussions without loss of consciousness can cause persistent post-traumatic headaches. Young people and those with a history of migraines are at higher risk. Rest is crucial after head injuries. Pushing through and returning to normal activities too quickly can make post-traumatic headaches worse and prolong recovery. If headaches after a head injury are worsening, you develop severe neck pain, or you experience confusion or weakness, seek emergency care immediately. Medication overuse headaches are different from rebound headaches, though they're related. These develop from using pain medications more than 10 to 15 days per month for over 3 months. They typically feel like a dull, constant headache that's present when you wake up. The pain improves temporarily with medication, but returns as the medication wears off. Triptans, opioids, and combination pain relievers are the biggest culprits. Even over-the-counter medications can cause this if taken too frequently. Breaking this cycle requires stopping the overused medication completely. The headaches will worsen for days or weeks, but then they typically improve dramatically. Prevention medications taken daily can help manage headaches while you withdraw from the overused pain relievers. A doctor's supervision makes this process much safer. New daily persistent headaches come on suddenly and never stop. One day you're fine, and the next day you have a constant headache that doesn't go away. The pain can feel like tension headaches or migraines, but the defining feature is that it becomes daily and persistent from the very start, with no pain-free days. These often start after an infection, stressful event, or minor head injury. The exact cause remains mysterious, and they're difficult to treat. Many people remember the exact day their headache started. It's this sudden onset with continuous pain that distinguishes it from other chronic headache disorders. Treatment is challenging and usually involves trying multiple preventive medications. Some people improve over months to years, while others have persistent symptoms. Cervicogenic headaches originate from problems in your neck but cause pain that radiates into your head. The pain usually starts at the base of your skull and spreads forward. These headaches are caused by issues with the bones, discs, muscles, or nerves in your cervical spine. Poor posture, whiplash injuries, and arthritis are common causes. The pain is typically one-sided and doesn't switch sides. Certain neck movements or positions trigger or worsen the headache, which is a key diagnostic clue. You might also experience neck pain, stiffness, and reduced range of motion. Some people notice their shoulder or arm on the affected side also hurts. Physical therapy, posture correction, and targeted exercises are the main treatments. Some people benefit from nerve blocks or other interventional procedures. Trigeminal neuralgia causes sudden, electric shock-like facial pain that can trigger headaches. The pain typically affects one side of the face along the trigeminal nerve distribution. Episodes are brief, lasting seconds to minutes, but they can occur in rapid succession. Even light touch, talking, chewing, or brushing teeth can trigger attacks. The pain is one of the most intense known to medicine. It's described as sharp, shooting, stabbing, or like electricity coursing through the face. This condition is often caused by a blood vessel pressing on the trigeminal nerve near the brainstem. Multiple sclerosis can also cause it by damaging the nerve's protective coating. Medication can help control the pain in most cases. For severe cases that don't respond to medication, surgery to relieve pressure on the nerve may be necessary. Temporal arteritis is a serious condition causing inflammation of blood vessels in your temples. It typically affects people over 50 and requires immediate treatment. The headache is usually severe and throbbing in the temple area. Your scalp may be tender to touch, and the temporal artery may feel like a hard cord. Other symptoms include jaw pain when chewing, vision problems, fever, fatigue, and unintended weight loss. If untreated, it can cause permanent blindness. This condition requires high-dose steroids started immediately to prevent vision loss. Blood tests and sometimes a temporal artery biopsy confirm the diagnosis. If you're over 50 with new severe headaches, especially with vision changes or scalp tenderness, seek emergency medical care right away. Occipital neuralgia causes sharp, shooting, electric pain in the back of your head, upper neck, and behind your ears. It follows the path of the occipital nerves. The pain can be triggered by touching the scalp, moving your neck, or even combing your hair. Some people also experience numbness or tingling in the affected area. This condition is caused by irritation or injury to the occipital nerves, often from tight muscles, neck injuries, or arthritis compressing the nerves. The pain comes in episodes, but can become constant if the nerve remains irritated. It's sometimes misdiagnosed as a migraine because it can be quite severe. Treatment includes nerve blocks, physical therapy, muscle relaxants, and anti-inflammatory medications. Severe cases might require surgical decompression of the nerve. Chronic daily headaches are defined as headaches occurring 15 or more days per month for at least 3 months. They can be transformed migraines or chronic tension-type headaches. Living with daily headaches is exhausting and affects every aspect of life. Work, relationships, and mental health all suffer when you're in constant pain. Some people are born with chiari malformation, but don't develop symptoms until adulthood. Others develop symptoms in childhood. Treatment depends on severity. Mild cases might only need pain management, while severe cases may require surgery to create more space for the brain. Trigeminal autonomic cephalalgias are a group of primary headache disorders that include cluster headaches, paroxysmal hemicrania, SUNCT, and hemicrania continua. They all share features of severe one-sided head pain with autonomic symptoms like tearing, redness, nasal congestion, and facial sweating on the painful side. What distinguishes them is the attack duration and frequency. Cluster attacks last longer, while SUNCT attacks are very brief but extremely frequent. These conditions are often misdiagnosed because they're rare and not well known. Seeing a headache specialist is crucial for accurate diagnosis and treatment. The treatments differ for each type, which is why correct diagnosis matters. What works for cluster headaches might not work for other types in this group. Cough headaches are triggered by coughing, but also by sneezing, laughing, straining, bending over, or any activity that increases pressure in your head. The pain is sudden, sharp, and severe, typically affecting both sides of your head. It lasts from a few seconds to 30 minutes. Most cough headaches are benign, but some are secondary to structural problems in the brain like chiari malformation or brain tumors. If your cough headaches are new, frequent, or severe, get a brain scan to rule out underlying problems. This is especially important if you're over 40. Benign cough headaches often improve with medication like indomethacin. Treating the underlying cough or avoiding straining can also help prevent them. Sex headaches occur during sexual activity and can be pre-orgasmic, orgasmic, or post-orgasmic. They're more common in men and often benign but startling. The pre-orgasmic type builds gradually as sexual excitement increases. It feels like a dull ache in the head and neck that intensifies with arousal. The orgasmic type strikes suddenly at orgasm, reaching maximum intensity within seconds. It's severe, explosive, and can be terrifying if you're not expecting it. These headaches are usually benign, but can occasionally signal a brain aneurysm or bleeding. If it's your first time experiencing one, seek medical evaluation. Taking medication like propranolol or indomethacin before sexual activity can prevent these headaches. They often improve on their own after several weeks or months. Cold stimulus headaches, also known as brain freeze or ice cream headaches, happen when something cold touches the roof of your mouth or back of your throat. The pain is sharp, stabbing, and peaks within 30 to 60 seconds, then fades within a few minutes. It's usually felt in the forehead area. This happens because the cold causes rapid constriction, then dilation of blood vessels in your head. Your body overcompensates trying to warm your brain. People who get migraines are more susceptible to brain freeze. The mechanisms that cause these headaches overlap with migraine pathways. Prevention is simple. Eat cold foods slowly and avoid letting them touch the roof of your mouth. If you do get brain freeze, press your tongue against the roof of your mouth to warm it. Hypoxic headaches are caused by lack of oxygen, commonly experienced at high altitudes. They're a key symptom of acute mountain sickness. The headache is throbbing, affects both sides of your head, and worsens with activity or lying flat. It's often accompanied by nausea, fatigue, and dizziness. This happens because lower oxygen at altitude causes blood vessels in your brain to dilate, increasing blood flow and pressure. Your brain temporarily swells slightly. Descending to lower altitude is the most effective treatment. Oxygen therapy and medications like acetazolamide can also help. Preventing altitude headaches involves ascending gradually, staying hydrated, avoiding alcohol, and considering preventive medication if you're prone to altitude sickness. Sleep apnea headaches are morning headaches caused by repeated breathing pauses during sleep. They typically affect both sides of the head and last 30 minutes to 4 hours. These headaches happen because sleep apnea causes low oxygen and high carbon dioxide levels during the night. This leads to dilated blood vessels and increased pressure in your head. Other signs of sleep apnea include loud snoring, witnessed breathing pauses, excessive daytime sleepiness, and waking up gasping or choking. If you consistently wake up with headaches that improve within a few hours, get evaluated for sleep apnea. It's a serious condition that increases risk of heart disease and stroke. Treatment with CPAP machines not only eliminates the morning headaches, but also improves your overall health and reduces dangerous cardiovascular risks. Hunger headaches occur when blood sugar drops too low from not eating. They typically feel like a dull ache across your forehead. These headaches often come with other low blood sugar symptoms like shakiness, irritability, difficulty concentrating, and weakness. When you skip meals, your blood sugar drops and your body releases stress hormones. These hormones cause blood vessels to constrict then dilate, triggering headache pain. Regular meals and snacks prevent hunger headaches. If you're prone to low blood sugar, carrying protein-rich snacks can stop headaches before they start. For people with diabetes, hunger headaches can signal dangerously low blood sugar, requiring immediate treatment with fast-acting carbohydrates. Hangover headaches result from alcohol's effects on your brain and body. Alcohol causes dehydration, inflames blood vessels, disrupts sleep, and drops blood sugar. The headache is usually throbbing, can be on one or both sides, and is accompanied by nausea, light sensitivity, and overall miserable feelings. Different alcohols cause different severity hangovers. Darker liquors like whiskey and red wine contain more congeners, byproducts that worsen hangovers. Drinking water between alcoholic drinks, eating before drinking, and stopping before you're intoxicated can reduce hangover severity. The best hangover headache treatment is prevention. But if you do have one, rehydration, rest, and over-the-counter pain relievers can help. Allergy headaches are caused by sinus congestion from allergic reactions. The headache typically affects your forehead, cheeks, and the bridge of your nose. The pain is often described as pressure or fullness rather than sharp pain. It worsens when you bend forward or first wake up in the morning. These headaches come with other allergy symptoms like sneezing, itchy eyes, runny nose, and postnasal drip. The nasal discharge is usually clear, not colored. Treating the underlying allergies with antihistamines, nasal sprays, or allergy shots resolves the headaches. Avoiding allergen triggers prevents them from starting. Many people mistake allergy headaches for sinus infections or vice versa. If symptoms last longer than 10 days or worsen after initial improvement, see a doctor. Eye strain headaches are increasingly common in our digital age. They result from prolonged screen time, reading, or any close-up work without breaks. The pain is usually felt across your forehead, temples, or around your eyes. It often starts later in the day after hours of visual concentration. Your eyes might feel tired, dry, or burning. You may notice blurred vision or difficulty focusing after extended close-up work. The 20-20-20 rule helps prevent these headaches. Every 20 minutes, look at something 20 feet away for 20 seconds to give your eyes a break. If eye strain headaches are frequent, get your vision checked. You might need glasses or a different prescription. Proper lighting and screen positioning also help. Dental headaches are caused by problems with your teeth, jaw, or bite alignment. Tooth infections, abscesses, or grinding your teeth can all cause headaches. The pain can be in your jaw, temples, or feel like a generalized headache. It often worsens with chewing or clenching your teeth. TMJ disorders, where the temporomandibular joint doesn't work correctly, commonly cause headaches. You might hear clicking or popping when you open your mouth. Nighttime teeth grinding, called bruxism, can cause morning headaches and jaw pain. Many people don't realize they're grinding until a dentist points it out. Treatment depends on the cause but may include dental work, bite guards, jaw exercises, or relaxation techniques to reduce teeth clenching. Medication side effect headaches can occur from many prescription and over-the-counter drugs. Blood pressure medications, hormone medications, and even some supplements can trigger them. Starting a new medication and developing headaches shortly after is a key clue. The headaches often improve once your body adjusts or the medication is stopped. Nitrates used for heart conditions are notorious headache triggers. They dilate blood vessels, which helps the heart but can cause pounding headaches. If you develop new headaches after starting medication, tell your doctor. They might adjust the dose or switch to a different medication. Never stop prescription medications without medical guidance, even if they're causing headaches. There might be alternatives or ways to manage the side effect. Postural orthostatic tachycardia syndrome, or POTS, can cause headaches along with dizziness when standing. The headaches often improve when lying down. This condition involves abnormal blood flow regulation. When you stand, blood pools in your legs instead of circulating properly to your brain. The reduced blood flow to your brain causes headaches, along with rapid heart rate, lightheadedness, fatigue, and sometimes fainting upon standing. POTS often develops after viral infections, including COVID-19. Young women are most commonly affected, though it can happen to anyone. Treatment includes increasing salt and fluid intake, compression stockings, medications to improve blood volume, and specific exercises to recondition the cardiovascular system. Meningitis headaches are severe, sudden, and accompanied by a stiff neck, fever, and sensitivity to light. This is a medical emergency requiring immediate hospital care. The headache feels different from any normal headache. It's often described as the worst headache of your life that comes on rapidly. You can't touch your chin to your chest because your neck is so stiff. Nausea, vomiting, confusion, and seizures can also occur. Bacterial meningitis is life-threatening and needs immediate antibiotics. Viral meningitis is usually less severe, but still requires medical evaluation. If you or someone you're with has a severe headache with stiff neck and fever, go to the emergency room immediately. Minutes matter with meningitis. Brain tumor headaches are actually less common than most people fear. Only about half of brain tumor patients have headaches as a symptom. When tumors do cause headaches, they're often worst in the morning and improve throughout the day. Vomiting can occur without nausea. The headaches progressively worsen over weeks or months. They may not respond to typical headache medications. Other warning signs include personality changes, seizures, progressive weakness on one side, vision problems, or difficulty with balance and coordination. If you have a new headache pattern that's different from your usual headaches, especially with neurological symptoms, get evaluated. But remember, most headaches aren't brain tumors. Giant cell arteritis, previously called temporal arteritis, causes inflammation of blood vessels and severe headaches in people over 50. The headache is usually new, persistent, and severe. Your scalp may be tender, especially when brushing your hair or resting your head on a pillow. Jaw pain while chewing is a characteristic symptom. Some people experience vision problems, which can become permanent if not treated urgently. This is a rheumatologic emergency. High-dose steroids started immediately can prevent blindness. Blood tests and sometimes a temporal artery biopsy confirm diagnosis. If you're over 50 with new severe headaches, scalp tenderness, or vision changes, seek emergency medical care. The risk of permanent vision loss is real. Intracranial hypotension occurs when spinal fluid pressure is too low, causing headaches that dramatically worsen when sitting or standing and improve when lying flat. This can happen spontaneously or after procedures like spinal taps or epidurals. Sometimes the cause is never found. The positional nature is the key diagnostic clue. Your head feels fine lying down, but starts hurting within minutes of sitting or standing up. Other symptoms include neck stiffness, tinnitus, hearing changes, nausea, and sometimes cognitive changes. The low pressure allows your brain to sag downward. Treatment depends on severity. Caffeine, hydration, and rest help mild cases. Severe cases may need an epidural blood patch to seal the spinal fluid leak. Vertebral artery dissection is a tear in the artery that runs through your neck vertebrae to your brain. It causes sudden severe neck pain and headache. This can happen from neck trauma, but sometimes occurs spontaneously or from activities like chiropractic manipulation, yoga, or roller coaster rides. The headache is usually one-sided and severe. You might notice a drooping eyelid, unequal pupils, or facial numbness on the affected side. This is a stroke risk emergency. The torn artery can form clots that travel to your brain or reduce blood flow enough to cause a stroke. If you have sudden severe neck pain with headache, especially after neck manipulation or trauma, go to the emergency room immediately. Reversible cerebral vasoconstriction syndrome causes thunderclap headaches from temporary narrowing of brain blood vessels. Multiple attacks occur over 1 to 3 weeks. Each headache is sudden, severe, peaks in seconds to minutes, and lasts hours. Activities like showering, exercise, sexual activity, or straining can trigger them. This condition is serious but usually reversible. It can lead to stroke or brain hemorrhage, so proper diagnosis and treatment are crucial. Women are more commonly affected, especially around childbirth or when taking certain medications like decongestants or antidepressants. Treatment involves stopping triggering medications, managing blood pressure, and using calcium channel blockers to prevent further vasoconstriction. Prognosis is usually good with proper treatment. COVID-19 headaches became widely recognized during the pandemic. They're often described as moderate to severe, throbbing, and resistant to typical pain relievers. The headache can occur with other COVID symptoms or be the only symptom. It typically affects both sides of the head and feels like pressure. Long COVID headaches can persist for months after the initial infection. They may be constant or come and go unpredictably. The mechanism isn't fully understood, but likely involves inflammation, blood vessel changes, and effects on the nervous system. Treatment includes typical headache medications, though they're often less effective. Some people benefit from nerve blocks or preventive medications used for migraines. Pseudotumor cerebri, now called idiopathic intracranial hypertension, mimics brain tumor symptoms, but there's no tumor. Pressure around the brain is elevated without clear cause. The main symptom is headache that worsens when lying down or with activities that increase pressure like coughing. Vision problems are common and concerning. Papilledema, swelling of the optic nerve visible during eye exams, is a key finding. Without treatment, permanent vision loss can occur. Weight loss significantly helps most patients. Medications to reduce spinal fluid production and sometimes procedures to drain fluid are used. This condition predominantly affects overweight women of childbearing age, but anyone can develop it. Regular monitoring by both neurologists and eye doctors is essential. Cervical headaches from whiplash injuries can persist for months or years after car accidents or sports injuries, even if the initial injury seemed minor. The pain typically starts at the base of the skull and radiates forward. Neck movement or certain positions trigger or worsen the headache. Muscle spasms, trigger points, and altered biomechanics in the neck all contribute. The injury damages soft tissues that take a long time to heal. Physical therapy focusing on neck strengthening, posture correction, and restoring normal movement patterns is the most effective treatment. Nerve blocks or injections might help break the pain cycle. Some people need ongoing management rather than expecting complete cure. Understanding your headache type is the first step toward effective treatment. Generic pain relievers work for some headaches but make others worse. If your headaches are changing in pattern, frequency, or severity, don't ignore it. Your body is sending you important signals. Keep a headache diary tracking when they occur, what they feel like, how long they last, and what might have triggered them. This information is invaluable to doctors trying to diagnose your specific headache type. Patterns emerge that aren't obvious when relying on memory alone. Remember, you don't have to live with constant headaches. With proper diagnosis and treatment, most headache disorders can be significantly improved. If you found this information helpful, make sure to subscribe and check out our other videos on health topics that could change your life.